So the remedy we're going to study today is something which we don't use often in our clinical practice. Unlike the allied remedy Argentum nitricum, which is often used in our clinical practice, Argentum met is not often used in clinical practice. And the reason why it is not used is because it is not highlighted adequately in our literature. How do we use remedies more in clinical practice? When you have numerous published case studies. Okay, when you have numerous published case studies, you will read about that more because then you have some clinical indications for it. Okay, Argentum Met is not used in a clinical practice that much because we do not have much published information on that. So that's the reason why, but it doesn't make it less useful. Okay, it doesn't make it less useful. Rather, when we learn about it, we might be able to use it better or more. So, for instance, when we talk about Argentum nitricum, we know numerous characteristic symptoms which are related to the remedy. Okay, so even if we are busy with our thing, or even if we wake up from our sleep and somebody says, "Tell me something about Argentum nitricum," so a few symptoms will always come off even from that sleep or that distraction, and you'll be able to talk something about it. When we think about Argentum Met, we don't really know too many characteristic symptoms of. So, when we study Argentum Met today, and whatever little that you know about Argentum Met over the years, what you've learned in your casual reading or whenever you've repertorized and you come across Argentum Met, and in fact, you'll find that in a lot of repertorizations, also Argentum Met doesn't come up that prominently. Argentum nitricum comes up more prominently. Okay, so whatever little you know about Argentum Met, I request you to keep it on your side today, and let's just study this small remedy afresh. Okay, so that we learn a few characteristic symptoms of the remedy and a few marked symptoms which are localized but pregnant with modalities or concomitants. Okay, and then we'll be able to use it with far more accuracy and far more understanding in our clinical practice. Okay, so like for instance, Argentum Met has a pain which is extremely characteristic and singular to only Argentum Met. Okay, when we say singular, it is a characteristic symptom in a Forsum 153 of the organon, and it means it is found in very few remedies and in very few people. Okay, so for instance, when we talk about Argentum Met, the pain gradually increases to the zenith, and once at the peak, it suddenly vanishes. Okay, so any other remedy which has this kind of a symptom? Pulsatilla, which has it so marked. Now, besides this characteristic of the pain, it also has a very marked modality, which means it is worse by touch. Okay, so for instance, Argentum Met, like rhododendron, has a strong symptom called crushing pain in the testicle. Okay, so both rhododendron and Argentum Met have it equally. Now, rhododendron is recognized more or understood more, but with that pain, if the patient cannot bear the touch of clothing, then the remedy is Argentum Met. Okay, so much so the pain is so intense that they would even want to keep the clothes off. It is that sensitive to touch. Okay, and it is also marked by a concomitant. That's polyuria. Okay, so with the pains, there will always be frequency of urination. Okay, so this is where you have to also keep thuja as a comparative remedy. Okay, but thuja will not have this kind of a character of pain, which will increase to a height and then suddenly disappear at the zenith. Okay, so it's like, it increases and then just disappears. Okay, uh, so this is one pain which is singular. This entire syndrome is singular just to the Argentum Met pains. Okay, then the other symptom which is extremely characteristic is in Argentum Met, and something you should keep in mind. It is one of the few remedies which has as a keynote, as a characteristic symptoms, indicated in tall, thin, and irritable people. Okay, which are the other remedies which have this in a very marked characteristic manner? Nux vomica. So tall, thin, okay, and irritable as well. That's also there in Bryannia. Okay. So it has a muscular constitution as well, but then it also has a tall, thin, and irritable constitution as well. So a remedy may have different constitutional phenotypes, as we say. Okay. So when we talk about tall, thin, irritable, we have to keep in mind Nux vomica is the topmost, then Bryannia and Argentum Met also has that. Okay. The other thing which it is especially known for is its expectoration. So you find a gelatinous expectoration. Gelatinous. G. Grayish, gelatinous expectoration, which comes up easily. So it's not difficult. So especially in the morning hours, they'll throw up a lot of gelatinous, viscid, grayish expectoration. So when we study this remedy today, so let's first study from Bonninghausen's work. Okay, so on the website homeoint.org, just open Bonninghausen and open Argentum Met. Are you there? Argentum Met? Yeah, in Bonninghausen's characteristics. Okay, so we're going to start with you. I'll tell you one section and you read from there. Okay, the entire symptom. Okay, whatever is mentioned there. So first we're going to read the generalities. Okay, please read from the generalities.
Bruised pain in joints,
Yeah.
sleep, positive sensation in extremities, pain in the internal organs as if raw or sore, epileptic attacks, effects of abuse of mercury and of onanism. Symptoms reoccur each
Every noon. Yeah. Okay, now when you've heard this, just process this because we're creating a new image of remedy. Okay, why do we read the generalities first? Because that's the backbone of Bonninghausen's work, the generalization. Okay, so how did he know these are the generalities? Because this is what was found throughout the proving in different sections. Okay, and then he also found that in the clinical practice to be relevant for prescribing. Okay, so do you know any uh, characteristic feature of epilepsies in or seizures in Argentum Met? So the characteristic feature of Argentum Met when it comes to seizures is epilepsy, which is followed by in the postictal phase with rage.
It's the person, yeah. It's the person's around.
Yeah, so there's this rage. So Argentum Met is generally known to be an irritable personality. Okay, and especially after the seizure. क्या हो गया? So it is the seizure episode. So generally what happens is you'll find in many of these seizure patients that after the patient recovers, they'll be exhausted or they'll go off to sleep. It is the other way around in Argentum Met. So right after the episode, they'll become extremely irritable. Okay? So, and usually that irritability is going to be violent. So that's why we use a bigger word than anger. We call it rage. Are we together?
Yes.
Yeah. Effects of abuse of mercury and of onanism. Okay, next.
What's
Now, so, नहीं आप रहने देना. Just let it be. Just let it be. हाँ, नीचे का. Sorry.
from the starting?
I'll tell you. I'll tell you. Thank you, Varun. Thank you. Okay, so Varun, read this section on mind and vertigo both.
Gentleman mind, anxiety driving him from place to place, rejection, taciturnity,
Okay,
vertigo with him.
so what all symptoms of mind do we know right now? So first symptom we know is irritability. Okay, that's the first symptom that we know. Okay, second symptom that we know, epilepsy followed by rage. Okay, that's the second symptom. Next, what we know? Anxiety driving him from place to place. Okay, and then there is dejection, and then there's taciturnity. What is taciturnity? No, no, no. Taciturnity is when they will have a very small reply to everything, and that's out of irritability. Okay, so that's taciturnity. It's also a symptom of basilinum. Okay. Okay, and uh, then there is one more symptom that you find in Argentum Met, and that's it is one of the deceitful remedies in our Materia Medica. One of the deceitful remedies of a Materia Medica. Deceitful. Are we together? Yeah? Soma, head, please.
Crawling and boiling in as from intoxication, hollow feeling in, with soreness of whole brain, present, tearing in skull, especially in temporal bones, smarting soreness on external, pressure and tearing in skull bones, or pressure and touch better open.
So, so they put a full stop here. It's actually smarting, soreness on external pressure, and tearing in skull bones. So that full stop is misplaced. Okay. So how do we know that? Because it is a remedy which is extremely sensitive to touch. Are we together? Yeah. So remember, when we study a Materia Medica, so we try to understand the entire pattern. Okay. Once you understand the pattern, you will understand the remedy better. Okay. Okay, Aditi, ears and nose, please.
Mind itching on external, nosebleed preceded by crawling in, severe
Okay, so Argentum Met has a very strong affinity for cartilages. Okay, so on the ear, the cartilage will be affected. So there might be soreness with sensitivity to touch. There might be itching, irritation in the ears. Okay, and similarly, it is in the nose because there's cartilage here also. So very strong affinity for that. Okay, sir, face.
Red pressing and tearing in the bone of swelled up lips,
Yeah.
mouth, raw and sore, smarting pain in throat when cupping, less when swollen, inflammation and narrowing of throat after abuse of mercury, so that food passes through with difficulty, sore throat as though swollen internally, sore burning vesicles on tongue.
Okay, so in face you find there is redness, pressing, tearing in bones of swelled upper lip. When you look at some symptoms of Argentum Met, they also are uh, in comparison with symptoms of Agaricus muscarius. Okay, that's why both are great remedies for ailments after alcohol or a drunken debauch. Okay, both have, like, in Agaricus also you'll find that the ears are red, inflamed. Okay, nose can be affected, there can be redness on it. Okay, it's also what you find here. Now, which remedy has pain in the throat, less on swallowing? Yes, Ignatia has that. Yes, less on swallowing. Ignatia is an important remedy. Okay. So, recently we've seen, we have a lot of people coming up with sore throat nowadays in this weather. You'll find people coming with a lot of viral, and after that, the sore throat persists for a long time. So, in our clinic, almost in 10 patients in last 1 month, we come across one thing very commonly. They said that, the pain in throat is worse when they swallow something solid. They'll have chapati, or they'll have a cookie, or they'll have rice. So it's painful, but if they drink something warm, they are better. Okay, that's something we found. Which remedy has that? No, no. Which remedy will have that? अच्छा देखो आप लोग मटेरिया मेडिका देखो. Tell me, look in the repertory wherever, but tell me what is the remedy which will exactly have that. No sir, there's only one remedy for this. There's only one remedy for this. No.
Spongy.
No. It doesn't have this precisely. It's better by warm drinks, yes, but doesn't have pain with swallowing solid. So empty swallowing, not that painful. It's only solids which are painful, and they can only have something warm to drink. नहीं सर, उसमें भी ये नहीं है. नहीं सर, उसमें भी नहीं है. There's only one remedy in the Materia Medica. आप लोग होम्यो इंट में एक बार वो खोलो. नहीं मैम, नहीं नहीं. आप homeoint.org में एक बार बोरिक खोलो, इसी वेबसाइट पे. नहीं मैम, नहीं, मैं आपको बता रहा हूँ. आप खोलो. आर यू देयर? homeoint.org, बोरिक. हाँ, बोरिक मटेरिया मेडिका. ओके, ओपन morphinum. In throat, when you open that section on throat, you'll find this precisely, and it is only found in morphinum mure, and it works like a charm. Okay, are you there? Yeah. Okay, so okay, good. What's your name, please? Deepa. Deepa, please read. Stomach and abdomen, please.
Stomach, appetite, unusually good, aversion to all food, even when thinking thereof, abdomen, painful, distension of flatulence or ache.
Okay, so it could have both kinds of appetites. Okay, can be either way. Next, sir, आप पढ़ें stool and urine.
Frequent soft, but always scanty. Urine, frequent urging to urinate with copious discharge with polyuria.
Yeah, and did you remember it's a concomitant to the pain? Okay, yeah. Mala ma'am, next 3 sections आप पढ़ें.
Almost every night,
By day,
easy expectoration, larynx, sore pain in must gelatinous layer mucus and which is easily expectorable. Upper extremities, tension and hearing in arms, especially in bones of hands and fingers. Stitches, lower extremities, stitches and hip when walking, pain in knee when sitting, hearing in bones of feet and toes.
okay. So, can you also open Bogers Synoptic key at the same time? Bogers Synoptic key. You'll find on the same side, and if you can just focus on the section on location. Argentum met me, sir. Yeah. What's your name, please? Huh? Kashit. Kashit, can you read the section on location? Bogus synoptic key. It's right on the top. Yeah. Yeah.
Nerves, cartilages and mucous membrane, larynx, bones, condyles, joints, genitourinary, left-sided, ovaries, testes, right.
Yeah. So what you'll see is that, usually you'll not find condyles mentioned in many of the locations or regions. So when we say condyles, because so you'll find in Materia Medica all the structures entering the joints. For instance, in Allen's keynotes, you'll come across the line structures entering the joints. So it affects the entire joint capsule, the cartilage, the tendons, the blood vessels, the nerves, and all of that. It is one of the excellent remedies for arthritis and periarthritis if symptoms agree. Okay? So, do we have some idea of the remedy now? Yes, no? Yeah, great. So, now let's read from Farrington. Argentum met produces spasms which simulate those of epilepsy. The attacks are followed by delirious rage. The patient jumps about and tries to strike those near him. It produces spasmodic pain in various parts of the body. Thus, it gives rise to pain in the head, which gradually increases and after reaching its acme suddenly ceases. The pain is usually on the left side and is often associated with vertigo. The patient's extremely forgetful. The heart muscle sympathizes in these neuralgic pains. There will be spasmodic twitching of the heart muscle, particularly when the patient is lying on his back. Now, the debility which naturally follows is very easily understood if you remember one quality of Argentum Met, that is its action upon the joints. It has particular affinity for the cartilages of the joints. Thus, we find general debility with bruised feeling in the small of back, from the weakness of spine, general weakness, weariness, forcing the patient to lie down to obtain rest. The knees are particularly weak. There will be not a true articular rheumatism, but an arthralgia, the pains of the same character as those of the head, which is pains will increase to a height and then suddenly cease. Worse by touch or pressure, and usually associated with polyuria. Okay? We find them in nervous hysterical women and in men after loss of fluids, particularly semen. Argentamate acts upon the mucous membranes of the throat and larynx. It produces in larynx a copious exudation of pure mucus, not purulent or not serous, but looking exactly like boiled starch, associated with burning and rawness in the larynx. And rawness and burning are excited by talking and protracted use of the voice. The mucus is easily expectorated. Argentamate acts upon the left ovary, causing bruised pain in that organ and sometimes a feeling as though ovary was growing large. This is purely a subjective sensation. Associated with this bruised pain, there is often a prolapsed uterus. So Argentum Met, like Stannum Met, has weakness in the chest. Okay? Both of them are also common that both of them have cough which is triggered by laughing. Okay, Argentum Met and Stannum Met in an equal intensity. Also there in Drosera, Phosphorus or other remedies. But when we talk about top remedies, it is Argentum Met and Stannum. Both have weakness in the chest. Okay, both have loss of voice or hoarseness of voice after public speaking or people who are speaking a lot. Okay, so in Argentum Met, there will be easy, profuse, gelatinous expectoration. In Stannum Met, there will be a sweetish expectoration. Are we clear? Yeah? Great. So, a small remedy, not because the symptoms are few, but it's majorly because people don't use it too much in clinical practice. It's a deep acting remedy. It's any remedy which is going to produce organic changes has to be a very deep acting remedy. But now that we've studied it, please read more about it. We'll be able to use it better in a clinical practice and probably help where probably we're prescribing other remedies. Are we together? Great. Thank you so much. Please, Patana. Please, Patana.
So you mentioned in mind deceitful rubric is there in Argentum Metallicum. Suppose it is one rubric only. So deceitful rubric you mentioned in mind that it is
Yeah,
a
it's a
deceitful.
symptom. It's a symptom. Yes.
Yeah.
Yes.
Suppose if we have to take this rubric only, there are so many medicines mentioned in this rubric. So how we can differentiate the deceitful nature of Argentum Metallicum with the other medicines? Suppose we consider this is the rubric, and how we will differentiate with the other medicines in clinic?
So, ma'am, so first, how will we choose whether it is significant enough for prescribing or not?
Yes.
Okay. Say, suppose we are able to obtain this in a patient. Okay. How will we know it is significant enough for prescribing or not? First, we know it is significant for prescribing when it occurs as a concomitant to the onset of disease. So when people will say his personality has changed, you cannot trust him anymore. And this has occurred as a concomitant to the onset of disease. Then it is significant for prescribing. Second, how would you verify it? And then, ma'am, how you differentiate it is purely on the basis of totality of symptoms. Always, always. Okay? It is a deceitful remedy, for instance. So, like for instance, there's another deceitful remedy in our Materia Medica, Nux vomica, also deceitful. Now, how do we know deceitful, for instance, is an important symptom of Argentum Met? Okay, so open Bogers Synopic, please. Do you see that? In Argentum Met. So there's the initial section of symptoms. These are the generalities. Okay. And then there is dot, dot, dot. Then you'll find hasty, semicolon, deceitful, full stop, talkative and forgetful, full stop. And that's how it goes. Are we together? Yeah. Now, in the entire Bogus Synoptic, ma'am, you'll find it is not mentioned in any other remedy except in Argentum Met. Are we together? Yeah? Excellent. So, we're going to meet up next month. Yeah? Thank you so much.
Thank you, sir.
Thank you.